Hi guys, you're welcome to another episode of Bulbling 247. Today I have with me Gideon Ogunbanjo, who is the founder and CEO of Nuvo AI. Gideon will be telling us more about the platform he's building. But when I reached out to him, he said he's building a open AI for Africa, and I was like, wow, that drew me into actually want to have this conversation with him to look at AI, artificial intelligence in Africa, and its usage in different contexts at the moment, how it's disrupting the spaces in different sectors, and again, how his own solution will bring change to the African industry. So yeah, Gideon, I'm happy to have you on this platform. Thank you so much for joining me for this conversation.
Thank you very much, Tony.
Yeah,
Thank
I'm
you.
doing
How are
good.
you
How
doing?
is it? What's the weather like at your own end?
Well, it's I would say somehow cold. It's been freezing all the day, but it's somehow cold, but it's fine. Um, at least there's no sun. I hate the
you,
sun,
you hate
so
the sun. What do you mean
as
by
long as
you
there's
hate
no
the
sun,
sun?
I think I'll be fine. Well, I wouldn't say I hate the sun. I would say I hate the heat that comes with the sun. I think I should
Oh,
put it
okay.
that
You
way.
hate the heat that comes with the sun.
It's
Oh,
it,
okay.
it's fun. It's fun.
Fair enough.
Yeah,
I mean,
yeah, yeah.
fair enough.
That's fine.
But so how have you been navigating the coldness?
Well, I think I prefer that to the heat, honestly speaking. So I'm kind of like used to that already in
Oh,
a way, but that's
okay.
fine.
That's good. Um, I have quite a lot of questions, and it's around Novo AI,
Okay.
and again around Nyla, which is your products, one of your products. Because I checked your
Yeah.
platform, you have Idea Vault and then Nyla AI. So,
Yeah.
but I am so much particular number one
Mm.
about the parent organization, which is Nuvo. You know what you're building, your vision, your
Yeah.
philosophy, and then most especially the future forward. So yeah. So but before we dive deep into conversations around Nuvo, I would actually love to get to meet you. Know a bit about your journey, how maybe your background has shaped you to what you're building at the moment. So how has that impacted what you're building? So yeah, can you tell me a bit about yourself?
Okay. I would say what first drew me to AI was practically curiosity, right? I was really just fascinated by the idea that machines could process information, create images. But I would just be honest with you in a way. I got into AI in particular. I got really interested into AI in particular when I watched Iron Man in the
Interesting.
MCU. I watched Iron Man, and he has this AI agent called Jarvis in a way. So he practically just tells Jarvis to do anything, and Jarvis just particularly does that. So I went to YouTube. I was watching a lot of YouTube videos on how tech creators were creating Jarvis and all of that. And I was kind of like really fascinated by the realization that AI is not just automating repetitive tasks in a way, but it expands human creativity, it amplifies intelligence, and it enables solutions that previously felt impossible in a way, So basically speaking, what excites me about AI right now is the boundless potential of generative AI in particular, um, on the playing field globally itself, but in
Oh,
Africa, especially, where young resources are, the gaps are kind of like significant, AI can bridge gaps between
yeah.
education, healthcare, commerce, fintech, and a lot of things, So a young student in Lagos or a young student in Nairobi can access the same quality of knowledge as someone in London or France.
Yeah.
So Western countries should not just have the upper hand. We are trying to like make Africa also have the upper hand. That's what really got me interested in AI in particular.
Oh, that's actually quite interesting. But at that point, which year was this? And at that point, what were you actually doing with your life at that point?
I was in high school. And this was like during COVID, 2019, 2020, during COVID. That was when I wasn't reading at all. I didn't think any students was reading during COVID. Honestly speaking,
Yeah,
I was watching movies,
yeah. The
I
news.
was watching anime and all of
Yeah.
that. So yeah, I just kind of like got into that in particular. Even my product Nyla AI, it's COVID kind of like inspired me to actually build Nyla AI in a way, but we'll still
Yeah.
get to that. No worries.
Yeah. I believe so. So after high school, did you go into the uni? What course did you study? And did that influence
Ah,
during that COVID time? Did it influence your decision in the course that you went to the uni to study?
After high school, I did not go to the university directly, there was this coding academy that I went to back then, a COVID ICT academy. I believe they're still functioning, I just learned basic front end and back end development, right? But like midway into that course, I started learning a little bit of AI already because I studied in
Yeah,
high school, So I was doing machine learning, deep learning, natural language processing and other things like that. And this was like because I graduated high school in 2020. So this was like in 2020, 2021. It lasted for a year.
yeah.
Then after that, I got my first international job. And when I got that job, honestly speaking, I was just kind of like discouraged to go to university, honestly speaking, because it was high paying. I was an AI
Oh,
intern.
okay.
It was high paying at the time. So I just kind of like really focused on that as a whole. But my dad was kind of like encouraging me to go to the university and all of that. So I just enrolled in an online university, which I am still doing right now at the International University of Applied
Oh, okay.
Sciences. So I just did that and I'm still doing that currently. So it's been a whole lot. It's been a stretch, honestly speaking. It's been kind of a
Oh, wow.
stretch.
I mean, you saw money at the early age, right? Right, and
Yeah,
you were
yeah,
discouraged because I mean, why go to school when you're already making money, right?
yeah,
As an
yeah.
AI intern, maybe your first week at that work, what was it like? And then, yeah, what was it like?
I did not know anything. At the time, amongst my friends, I was kind of like this AI guru in a way.
Okay,
Like almost every person, some people used to call me an ML warrior. Some people used that
yeah.
machine learning warrior in a way. Some people used to call me an AI guru and all of that. So I kind of like was very overconfident when I walked into that job. I was like, there's nothing they want to do I cannot do. I believe the first task they gave me was something concerning image segmentation, all of that when it comes to crop disease detection. And oh my goodness, at the time I could not really use
Oh,
ChatGPT
okay.
like that. So it was heavy and the I think the my supervisors in the company is an
Okay.
Indian. He kind of like detected that I was not really conversant with that because I was kind of like used to linear regression, logistic regression, deep learning, neural networks and all of that. But image segmentation or image detection was something I never really delved into, even though I really knew it. So I remember whenever I was giving tasks, I would call him on Google Meet, we would be sharing our screens back and forth, assisting me on how I can do all of that. And eventually I picked it up, eventually I picked it up and I
Oh,
performed well.
that is it's good that you picked it up, but I believe that at that point,
Yeah.
did it not occur to you that maybe did like imposter syndrome setting, and maybe you feel like, oh no, I don't fit into this space, or all of the things that I think I know, I actually don't know anything. Did you have that feeling at that point?
Yes, I did. I think that's one of the reasons I'm going to emphasize a very good supervisor,
Yeah,
a very good supervisor really does a lot when it comes to training maybe an intern or a junior developer or something because I remember they gave me the task for like 2 weeks. I wasn't joining stand up, I wasn't doing anything. So he probably detected
yeah.
that I couldn't do it. So he reached out to me on WhatsApp and was like, what's going on? And I told him that the task I can't do it. So he kind of like put me through. Then he also told me about his experience
Oh,
when he joined Meta,
yeah.
which was Facebook at the time. He was working for Facebook at the time. That when he joined them, he lied on his resume that he could do some things. And when he eventually got the job, they found out he couldn't do those things. And his supervisor kind of like put him on, kind of like trained him on how to do everything. So he just basically just transferred that particular sentiment, or
Experience,
should
yeah.
I call it experience, over to me. Yeah, training me and all of that. And it worked, honestly speaking. I felt the imposter syndrome, but with his guidance and his help, eventually, as I was working and I was picking it up, my skills were improving.
And
I
you
kind of
were able
like
to beat
validated that
that.
completely.
I mean that's good.
Yes, I
That's
was
good
able
to
to
know.
beat
But
that.
so while you were working there, what were the other tasks that you
Mhm.
did, and how did all of the work as an intern shaped you to become who you are at the moment?
Well, most of the tasks they were giving me were just personal projects they were working on. I don't think most of those products are still active for now. There were a few personal projects we were working on at the time, and it was kind of like a stretch we were working on because the company was practically focused on them. They were kind of like my company now, focused on different sectors. But when I joined, they were working on drones for agriculture, drones
Okay.
that can actually detect plants that are dying and things like that. That's why I was working on image detection and all
Yeah.
of that. Those were kind of like part of the things we were working on. Then when there's just some minor other tasks, for example, their websites, they were trying to build this chatbot on the website that was trained on the company's data,
Okay.
So there were just a few of those kind of new technologies that I wasn't really conversant with. But working in the company and learning those particular technologies, I learned a whole
So
lot from it.
how many months or years did you spend with them?
I spent about 9 months with them. Yeah, 2020 to like 2021. I spent about yes, no, 2021 to like 2022. I spent about 9 months over with them. And honestly speaking, they were kind of like they were one of the best people I've ever worked with. Aside from the pay was actually very good. I was a big boy at the
I mean,
time. The pay was actually very, very
secondary
good.
school, out of secondary school, yeah, you're home in your
Yeah,
father's
yeah,
house.
yeah, yeah,
I mean, what more can you
yeah,
ask for from life at
exactly.
that point?
The pay was very good and the experience was actually very, very good. It opened me to a lot of opportunities. It opened me to a lot of opportunities through that particular company. I got interviewed for the Google
Okay.
Step internship at the time, even though I didn't get in, but I like got an interview out of a whole like
Yeah.
numerous amounts of people. I got two intensive interview sessions with both of their recruiters, and even though I didn't get in, but it was kind
I
of a
actually
great
believe
experience
that
at the
even
time.
though you didn't get in, that alone would boost your confidence. That come on, I'm at the point where I can now
Yes,
interview with this
definitely.
level for this level of work of project and with this such big
Definitely.
organization. That alone is a confidence booster. So
Definitely.
I believe it was
Definitely.
good for you at that point. Yeah, even though you didn't get in, but now after you left there 9 months, after 9 months you left there,
Yes.
and I mean, in my research I discovered that you started Nuvo 2025, right? Or when did you start
Yes.
Nuvo?
2025. Yeah.
So between that time, so between
2025. Yeah.
2020, 2021 to 2024 to August 2025, what have you been doing?
I worked for three companies after that. The one I worked for after the Indian company that I worked for was a company called Zot Cloud. They were into like cloud solutions and all of that in Nigeria. Yeah, I worked as a front end developer. Well, a front end developer that moved into like full stack development. I learned a little bit of Laravel, PHP, and all of that. So it kind of like gave me an experience where even though I was coming from the AI aspect alone, I
Yeah.
kind of like had enough because I learned front end development, like I mentioned, in the tech academy I went to. So I learned back end technologies. I did not know how to use PHP before because, frankly speaking, I did not like PHP. I don't think most people don't like PHP. There's this kind of like stigma that PHP has. But I learned PHP and it's actually very, very useful. We use PHP in my company right now, even though
Okay.
it's something that most people think is outdated or something,
Yeah.
but we still use PHP in my company right now. So that was Zot Cloud. Then after Zot Cloud, I got into a company, Diverse Labs. That's the name of the company. They're based in the US. They were building this talent acquisition
Okay.
large language model or
Okay.
platform called
Oh yeah,
Lovely
yeah, yeah.
AI.
I
So
think I
I
do know. I know
applied for
that.
that. Yes, I applied for that and I got in. Yes, and I got in and I worked for them for about 6 months. Yes, I worked for them for about 6 months. I kind of like underperformed, but I don't think you noticed that. But we built the large language model is called Jabari.
Okay.
It's kind of like used for talent acquisition and all of that. So I left them. It was an internship actually. So I left them after the internship was over. Then I joined them another company called Abbott, which specializes in campaign management, advertisements and all of that. So they practically wanted to you just bring in AI functionalities into that.
Oh, okay.
So I kind of like helped them with that for a while. Then I left. And the reason I left is actually very funny. So every human being, or should I say every person, has kind of like an inflection point
Yeah.
whenever they're in their career and all of
Yeah.
that. So I was promised this big job. They were telling me in Nigeria, this was in 2025, they were telling me in Nigeria just this year that I was going to be earning 4.5 million
Which is
naira
big. Which
every
is
month,
big money.
which is
Of course.
which is big, which is big
Big.
money, honestly, because for the workforce in Nigeria, it's a
Yeah. It's
lot.
a lot.
So I left the company instantly and I was waiting for them to give me an offer letter and I just found out
Ooh.
that the job kind of like left me and went to another person. And I know the person the job went to. So and the person is, should I say, I don't know if this is gonna be right to say, but kind of the person is kind of like unqualified to have the job,
Okay.
but he still
I
got it in a way. So I was kind of like I was really, really down, because I've left the other job already and I was already with them here. And they just told me that there's no more space. And I kind of like knew them at the company. I think that's what made it worse, you know. So it kind of like made it worse. So I just thought about it that maybe I should just really focus on Nyla because at the time I was already building the AI engine. I was building the
Okay.
front end for the website and all of that. So I just called my dad. I had some money with me. I called my dad. I told him I want to register a company. And you know, African parents now, that was like, what do I want to register a company for? What am I doing? This and that, this
Yeah.
tech stuff, you know, he was kind of like being skeptical. So I just told him what I was
Yeah.
doing. He didn't understand. He didn't understand at the time, you know. But he has friends who are medical doctors. In our family, we have a lot of friends who are medical doctors, even though none of us are pursuing the profession. Right. So he called like four of his friends. We had a Google Meet call and they were all interested. All of them
Wow.
have hospitals. They were all interested in the product. So my dad was like, okay, he would facilitate a lawyer, would register the company and all of that. And that's how Novo AI came to life, honestly speaking.
Wow. I mean, wow. So before even building, you already have like a market fit. You already have like
Yeah, yeah,
users that are on your wait
yeah,
list that you have not created
yeah.
yet.
Ready to use the product.
I mean
Yes.
that's interesting. But we'll get to Nyla, right? I kind
Yeah.
of like how we're bringing the beats and pieces of your story together. You know, from
Mhm.
the COVID period to some of the organizations that you work with, and then some of the projects that you've been able to work on, right? Which I believe that will have really, through that you've sharpened your skills, you've built
Yeah.
confidence, you've built capacity, uh, to lead the project that you're leading at the moment. So at that point, so was it at that point you that it was it that project that gave birth to Nuvo before Nyla? So
Yes.
what's the yeah? So what I know Nuvo is the parent company. Nyla is one of the
Yeah.
products, right? But for the sake of our listeners or people who would watch this conversation, so what's the difference between Nuvo AI and Nyla AI?
So I think I should just give a brief overview of what Novo AI is in particular,
Yes,
right?
yes,
I was learning French. So the word nouveau in French means new, you know. So I just practically thought of new applications of AI because Nyla AI is the only kind of its product in Africa. So I thought
yeah,
of a company that builds new applications of AI, you know, products that can show new applications of AI. So I just converted it to English and named it Novo AI. So Novo AI is the parent company, which is an African AI research company that researches key sectors in Africa with challenges. Technically speaking, there is no sector with no challenge, right? Every sector in Africa has a
yeah,
particular challenge or the other, right? So we isolate those
yeah,
challenges and we build AI powered solutions to solve problems in those sectors, you know. And we are starting with healthcare
yeah,
with Nyla AI in particular.
yeah. So you frame Nuvo AI as the as a movement. You framed it as
Yes,
a movement for the next generation of African intelligence, because that's
yes.
some of the words you used on your platform. So I would what does African intelligence actually mean to you in the context of AI research and development?
So basically speaking, the vision is kind of like to create not just luxury products. In fact, not luxury products, but necessities that are available to everyday people. Whether it's a farmer needing agricultural advice, you know, a patient or a hospital or a pharmacy needing healthcare support with AI, or a business trying to operate effectively, you know. We
Yeah,
are just trying to build AI products that understand our cultural like context, you know.
yeah,
If I speak Yoruba to ChatGPT, I doubt if it can actually give me Yoruba in a Yoruba accent, like back, you know,
yeah,
something like that. So we're just trying to build culturally relevant AI solutions that fits Africa as a
yeah.
whole.
Well, um, that actually takes me to question around. Sometimes we different organizations, right? I wouldn't want to mention them.
You know?
Sometimes we throw around words. We say we want to build solutions for everyday people in
Mhm.
Africa, in Lagos, in Nigeria. But at the end of the day, when you drill things down, when you look at the operations of the company, you discover, for example, banks, they'll say we want to bank the unbanked, right?
Mhm.
And that, but their products actually doesn't even capture the people that actually the unbanked. Sometimes
Yeah.
some of these products are more elitist, in terms of their coverage, in terms of their the market that they're capturing, right? You want to bank the unbanked, you can be found in the remote areas of say maybe in one village in Oshun. you have some cooperative society who are people who are really unbanked, who in
Yeah.
your product messaging, in your brand messaging, you say you want to bank those unbanked. So now coming to your own to Nuvo, right? You're building solutions, to build for accessibility to everyday people. So how do you ensure that the solution you're building are actually accessible to everyday people in Africa?
I think one of the main issues we have in Nigeria right now is electricity.
Yeah,
I think that is like the main issue we have in Nigeria. That's why we are starting with mobile devices. Eventually, we would scale where our products would actually just be used maybe through SMS or voice.
yeah,
But for now, we are practically using mobile data, Android devices. For example, if a person has a button device,
yeah,
most of our products cannot be accessible for that. But there's this particular saying I like to say, if there is a technological problem,
yeah,
there should be a technological solution.
yeah,
So we have identified a technology problem in Nigeria and we've built a technological solution. Now, the end or the surface part of that particular quote says those technological solutions would evolve.
yeah,
Those technological problems, sorry, would evolve. So the technological solutions also should evolve.
yeah,
So our product, my tagline in Novo AI is research, build, and evolve. Research sectors that need help or need solutions, we build those solutions and we evolve those
yeah.
solutions. So eventually, our products will be accessible to everybody, whether they have internet connection or not.
Great.
And we are already working in line with that. We are partnering with a major telecom platform. I can't reveal
It's
much
fine. I
information,
get.
but we are partnering with a major telecom platform in Nigeria, or should I call it Africa, currently. And very soon, our products will be available for everybody. Whether you have internet connection or you don't have internet connection, it's not going to be a problem.
Oh, great. So at the moment you have, I know of Nyla, I know of Idea Vault, but
Yeah.
there is no more details to Idea Vault at the moment. But you,
Okay.
you have, but you have a whole platform for Nyla. So
Yeah.
what does Nyla actually do?
So, Nyla AI in particular is, should I say, it solves the problem of accessibility and inefficiency in healthcare. So it
Yeah,
is Africa's first AI-powered ecosystem for users, hospitals, or clinics and pharmacies. So in Africa, basically speaking, healthcare feels like a privilege. Clinics are overcrowded, users don't have instant healthcare,
yeah,
doctors are overstretched, they rely on paperwork, and people only seek help when conditions have worsened. Honestly speaking, it is when they are bedridden
yeah,
that they remember that they want to go to the hospital or something. So basically speaking, Nyla AI brings healthcare closer to the people who need it by providing 24/7 access to an AI-powered health companion
yeah,
that can analyze your symptoms, you can track your health metrics, and you can even connect with hospitals or pharmacies with a lot of tools we've added on there. That is for the patient side. Then for healthcare providers, which are clinics and pharmacies, Nyla AI reduces operational burden by eliminating paperwork completely from your clinics or your pharmacies. So clinics and hospitals can manage their appointments more effectively. They gain access to an AI-powered EMR, which is an electronic medical record
yeah,
system. They can track their patient's health history from the particular portal. They can generate automated reports and many other activities, many other features, sorry.
yeah,
They have a group of AI agents working together, collaborating with doctors on that particular portal to make sure that patient satisfaction is at 100%,
yeah,
honestly speaking. Then pharmacies, on the other hand, gain tools of their own, like AI-powered prescription management, inventory control, and many more. So Nyla AI is addressing the system holistically, honestly speaking, empowering both patients and healthcare providers to operate more effectively. That's like a general overview of what Nyla AI is.
I think it kind of covers. I remember I can't. There was I think there was a program I did at the time that was with the ALS Africa. So and part of the task was to develop like a product, that would address these particular challenges that your product actually address perfectly. To be honest, we're looking at building digital record, a record where the pharmacies can get to see that, okay, let's say for example a doctor has prescribed these so drugs that you need, or medicine that you need to take, and then you have pharmacies are also onboarded, and they also get to see that, okay, you need this drug, you can access you can approach a pharmacy, your own pharmaceutical company, that they say, okay, this particular drug has been prescribed by this doctor, we can be able to get this. So this way, you are able to be provided a whole thorough health care that actually more personalized, actually more personal. And I believe that this is what your platform is actually doing. And I believe it's also kind of broader than what we're able to sketch out at that time, which is also quite interesting. So at the moment, before I even go to about in terms of the ethical part of it, in terms of the data privacy, healthcare data is very very sensitive, right? And it has to be well protected. But before I go into that conversation, I just want to have an idea of at the moment, you the other time you talked that you already have people on your waiting list, on your wait list before you even built the solution. So but at the moment, how many users have you onboarded from the patients, then the doctor, the hospitals, then the healthcare centers, then the pharmacists? How many users do you have onboarded on your platform at the moment?
Basically speaking, we have hundreds of users already on the products, right? Like
Okay.
for you, like patients. Then we are starting with because we had some issues trying to like onboard hospitals, but we've had
Okay.
written MOUs, which is written partnerships with 7 hospitals across Lagos State already. 7 hospitals across Lagos State. Then we have 4 pharmacies, but I don't want to target pharmacies like individually, right? I want to target
Okay.
a group of pharmacies, like let me just call it one pharmacy that has a lot of pharmacies out there, So that's what
Yeah.
I'm trying to target. I'm meeting up with one of them. It's just it's not being sealed, so I can't really reveal too much information. I'm meeting up with one of them
Yeah.
tomorrow. Then I think the biggest scale that we currently have is with the Ministry of Health in Lagos State. We are working closely with the Ministry of Health in Lagos State. Like I said, the partnership has not been sealed yet, so I can't really reveal much information, but it's definitely something big. So in terms of traction, we have a lot of traction already because people are really, really interested in the product. Then, like I said,
Yeah.
one of the reasons why we're kind of like slow was because I don't have any background in medicine, right? I am just
Yeah.
into AI and all of that, but I have a solid board of advisors, that are globally recognized. One of them works in Lasuth. His name is Dr. Taiwo Omoshebi. He works in Lasuth, in Lagos State. So I have a solid board of advisors that kind of like guides me, and kind of like connects me to these particular people so that I can just
People.
get
Yeah.
effortlessly. So in terms of traction, we have a lot of traction already. The reason why we are not pushing the mobile application out there as a whole is because I specified on the website that the mobile application is in its beta phase. We just use it to
Yeah.
like
I saw
test
that.
users. Yeah, we use it to test
Yeah. I
users.
saw that.
So eventually, sometime in November, we will release the full product, and once we release the full product, we will like push it out there, major advertisements and all of that. Billboards, like everybody will see Nyla everywhere, because one thing I've seen about users is you need to kind of like force some products down their throats so that they can actually use those
Yeah.
products. So people are
Yeah.
going to see Nyla every single way. And another thing we actually did, some of the medical doctors we have, like the ones I spoke to, and some who are even our advisors, hold notable positions in medical associations across like Lagos State, because they have different
Yeah.
medical associations. So through those medical associations, we are going to connect with a lot of hospitals. I have noted over 300 already that we are going to go to. So after that, all I'm just going to be focused on is onboarding and training them, because our product is unlike any other product. And like I said, it is something completely new
Yeah.
in healthcare. So we need to like dedicate time
Yeah.
to actually train them on how to use the product itself. So that's that. In terms of traction, we have a lot of traction already, even though we are still in our early stages. We launched it on August 20, and between August 20 and now, let's just say, on an estimate, it's kind of like a month already, and we have a
Yeah.
lot of traction already. Yeah, that's that.
Yeah, it's good that you already have a traction. I mean, because you already have people on your wait list
Yeah.
before the building the product, which is actually quite amazing. I actually, before I also go into I already have talked around privacy, ethical, but it's a conversation that we have. I actually want you to walk us through how it works properly. Okay, let's say I'm a patient. If I log into the platform, what will I do? What information do I need to input into the platform? And how do I get maybe doctor on the platform? And how would that doctor engage with me? Like, how does it work, like from point A to point B, and then how would I, as a patient, say, okay, this platform is great. I've actually gotten everything I need on this platform. How does it work uh properly?
Okay, so for users, it's a mobile application. Eventually, we're
Yeah.
going to scale to another way, like I mentioned earlier, where they can access Nyla AI. But for now, it's a mobile application. So basically speaking, it's only available on the Google Play Store for now, right? So
Okay.
once you download it on Google Play Store, you just basically sign up since you're a new user. Once you sign up, you
Yeah.
use your email address and your password, which we don't have access to. Of course, we
Okay.
don't have access to that. Ethics in healthcare is non-negotiable when it comes to data privacy
Yeah.
and all of that. So
Yeah.
once you log in, you face a dashboard. It's a pity I can't really share my screen to show you anything. You face a dashboard where you have different health tools. You have the chat assistant Nyla AI itself that you can chat with and gain your symptoms. Then I think I forgot to mention this, but we have two dashboards, one for men
Okay.
and one for women. So for
Okay.
men, they get specific gender tools too. Like we have a tools tab where we have body mass index calculators. We have
Okay.
testosterone trackers. We have mental health trackers, amongst many other trackers. Then for the women, instead of testosterone trackers, we have a period tracker. So with Nyla AI, women can
Yeah.
actually track their menstrual cycle, gain insights on their menstrual cycle, and all of that. We have mental health trackers and all of that. Then also we have a
Yeah.
tab where users can actually book appointments with hospitals that have been onboarded onto the platform, and with other medications from pharmacies that have been onboarded onto the platform too. And
Yeah.
as we scale, we are going to make that user interface significantly better, so that first impression matters. That's basically it when it comes to products. Then for hospitals in particular, hospitals kind of like have a more rigorous process because, like I mentioned
Yeah.
earlier, data protection and ethics in healthcare is non-negotiable.
Mm.
So they
Yeah.
have to face on the portal. They have this onboarding screen that they particularly just fill information about their hospitals on. Then once they click send, we get that information on our admin dashboard. So we actually review that particular hospital and see if it's a credible hospital. Then we approve the hospital. Then they get access to their AI powered dashboard. They can manage their patients.
Yeah.
They have their own AI powered EMR. They have AI agents. They have a chat assistant like ChatGPT on their portal that is multimodal. So it supports an image, it supports
Yeah.
files, it supports text, amongst other features, on that particular portal. And the same process goes for the pharmacy portals too, where they have an onboarding screen where they actually kind of apply to use the product. And once we see that
Yeah.
on our admin dashboard and we approve, they gain access to their own AI powered tools and all of that. So that's practically the sequence of how the three
Of
portals
Vital
work.
Works.
Yeah.
Yeah. So how do you ensure, what system have you put in place to ensure privacy, security, and compliance with ethical standards?
Yeah, so we follow this NDPR and GDPR
And
standards.
GDPR.
So the patient's data we've built the system in such a way that the patient data is encrypted from end to end. Users have control over their data. Nothing is shared without explicit content. And another advantage I have over other telemedicine platforms is most telemedicine platforms, they partner with each other. So let's just say one is for
Yes.
hospitals and another one is for pharmacies. They partner with pharmacies.
Yeah.
So technically speaking, your data is being shared with those pharmaceutical and partners that they have. But
Yeah.
on Nyla AI, your data is yours and yours alone because we are not partnering with anybody. So it provides guidance, final diagnosis and treatments. It remains in the hands of licensed doctors themselves. So concerning safety
Okay.
too, our AI never replaces medical professionals, right? I think I explicitly
Okay.
stated that on the website. Instead, it complements them.
Yeah.
We're not trying to replace doctors, we're trying to augment, or should I call it, make their performance better with AI,
Better, yeah.
Yeah, that's basically. So we recognize the risk in healthcare, it concerns life and death scenarios, That's why our
Yeah,
design is augmentation, not replacement, Nyla AI is a
Yeah.
partner in healthcare, not a substitute at all. I think I emphasize that on every presentation we go to, in every hospital that we go to. I emphasize that.
I think I saw that that was well emphasized on the
Yeah.
website.
Yes.
I mean, I looked at the homepage, it's there. I looked at the about us, it's there. you highlighted that fact that you are not replacing doctors, you're just making their work better. Most especially in terms of production, productivity, and then efficiency in delivery of healthcare and wellness. So that actually is well emphasized on the platform and in your communication so far that I have seen. So which is quite commendable. So let's talk about
Okay.
funding and sustainability of the organization of your company.
Okay.
So how at the moment, the different solutions, just like we have startups, tech startups in Africa at the moment, we struggle with funding,
Yeah.
right? A lot, right? Even though you're building the best solution that you can imagine, if you are not backed with some good strength of money, it's a lot
It's
of
a
charge. So
problem.
how are
Yeah.
you? It's a problem. So how are you? Navigating that funding phase. Are you funded at the moment? And how have you been, sustaining your organization at least with the little progress that you've made so far?
I've been funding the project myself. That's basically it. I tell people that, and it kind of like sounds strange, But
It is.
one thing I really appreciate about Africans is I have never met an African who is dumb. I would use that word, or unintelligent in a way, Most of the staff who work with me are very smart people. So before we actually interviewed, like when we were interviewing them, I told them that, look, we don't really have much money, right? But this is what we have,
Oh, yeah.
right? So, aside that, the company is we kind of like have a multi-layered approach, So we're not just building one product in particular, So, first, one of the things I used to raise funding was the hospitals, our clinics we actually partnered with in Lagos State. We kind of like build them
Yeah.
beforehand, So they kind of like give us something
Yeah.
in advance, So we actually use that to improve the products and all of that, and actually just gain stuff and all of that.
Yeah.
Then we also have a group of advisors. One of those advisors, actually,
Yeah.
the chief financial advisor, actually gave me some money. It was actually kind of like a shock. I just went to see him, and he just told me, the African mentality now. A younger one comes to visit you, you just want to give him something on his way home. He told me
Yeah, you just want to. Yeah,
he
yeah,
told me he
yeah.
wanted to give me transport money, and he actually transferred 2 million naira to me.
But it was huge.
Yeah, 2 million naira,
Ooh,
and he told me
that's
he
wow.
told me transport money, and it just kind of like came as a shock, So we just kind of like scaled quickly, did whatever we wanted to do, and then currently right now we are not funded like I mentioned, but we are currently fundraising. We are in touch with some investors. We are in touch with some meetings, and hopefully before the end of the year we will gain some significant funding, so that we can push many products in our pipeline.
And how is that conversation going? Is it positive?
Yes,
how's
positive.
it going?
Like I said, before the end of the year, hopefully we would raise some significant amount of funding.
Okay.
I have 8 products in my pipeline. Nyla AI is the first. So right now I have 7 remaining products in my pipeline, and I all added that in my pitch deck. So one of the reasons why I'm very stringent with investors is most companies, when they are raising funding, the company is the product, software as a service kind of like thing. But I am kind of like a parent company with many other products under me, So I'm kind of like very stringent with how much equity I'm willing to offer and all of that, which kind of like drives investors away, But one thing our financial advisors advised me was I should not cut my wings for anybody. Whoever wants to see my vision would see my vision and actually invest in it. So it's a whole lot, honestly speaking, it's a whole lot. And hopefully before the end of the year, we would raise some significant amount of funding, to kind of like push Novo AI and most of the products we have out there out on it.
Wow, that I mean, I really pray that they come true.
Thank
To be
you very
honest,
much.
so let's assume that some $50 million or even naira hit your account now. Like what areas are you putting more? Are you planning to put money into?
I think if I get that amount of money right now, I think I am going to attack the market aggressively. One of the mistakes I made while building Nyla AI was, like I said, I'm a developer. I mainly focused on the development aspect, and I didn't really focus on marketing, That's why the whole concept of building public really stands out, So I think I'm going to attack the market aggressively, Everybody uses TikTok. I was still speaking to a friend on Thursday. Yes, I was speaking to a friend on Thursday, and she was even telling me that I am addicted to TikTok because I use TikTok a lot. So There are content creators in Nigeria that we can actually just partner with,
Yeah.
tell them, oh, I built this product,
Yeah.
push it out for me, and all of that. So we can actually even get some of them as ambassadors for the company, So every single product we build, we kind of like push it out. Then, aside that, I am going to dedicate, I think, most of what we are doing to our product and development, One statement I learned from Barack Obama, he used to say that thing back then. He used to say, do things, eventually people would notice. So I think that's one of the things that I want to do. I just want to build my products. Eventually, people would actually see that there's this particular product out, a company out there building these particular products that we don't really have, but we really need. And the product is going to like gain hype on its own. So that's practically what I'm sure I'm going to focus on.
I think around that I can actually give you one or two advice on that, around the marketing, because that's my own forte, right? It's very key that you start telling your stories. Even from the founders' point of view, you want to tell. Now we're at the time now that we're talking about personal branding for founders, right?
Mm-hmm.
So you need to start telling your stories, what you're building, how you're building, some of the challenges you're facing, and then how you're able to navigate some of these challenges. It's very important that you tell your stories out there. So that way, I believe that even while you're building this product, you're also using your own network to also build trust. Because most with the platform that you're building is a platform that is very key on trust, right? Healthcare is very, very key on trust, because if people don't trust, uh, people ordinarily can trust their data with so many things. Oh, you want to buy something or e-commerce platform, they can easily trust their data with that, right? But when it comes to healthcare, when it comes to healthcare, it's something that people
Life and death.
even it's life and death. Yeah, a lot of people don't even trust their data with their doctors.
Exactly.
Like with some doctors, let me say with some doctors, yeah. So that's why some people they prefer that, okay, this is the hospital they know, this is the doctor they know, and whatever happens to them, they always want to go back to that doctor to ensure that it's only him or her that attends to them. So this your platform is something that it's so key on trust, and I believe that you need to be more intentional. Let's look at the vision. So I mean, before I go to the vision,
Okay.
you have users at the moment. What have been the feedback like?
Oh, a lot. We actually posted something on Instagram and LinkedIn. A lot of people actually like it. One of my fears was
I saw a couple of them this morning.
One of
Yeah.
my fears was people won't really. I knew that people would like the hospital and pharmacy part of it. But our main
Part
primary,
of
like
it,
our
yeah.
primary,
Yeah.
our primary market our primary users are like patients. So I was worried that people
Yeah.
were not really going to like the UI, like the mobile applications UI on the Play Store, because we didn't really give the mobile application developer a design. We just told him to build it. So he just built it
Okay.
off the top of his head, And we actually got a lot of feedback in our emails and all of that, Some people were commending the menstrual cycle trackers. Even a doctor, actually, we added that on there.
Yeah.
He actually emphasized that. One person, I think her name is Aisha, she even stated it that if the product is this refined in its beta phase, she is really waiting for the full product. And I can tell you confidently here,
Yeah, I saw that.
the full
Yeah, I
product
saw
is
that.
going to be something you've never seen in Africa. A better UI, more AI powered functionalities, and many more. Honestly speaking, so it's going to be way more better. It's going to be way better than the one we have now.
So yeah. So in terms of the feedback, do you have feedback around maybe functionalities, maybe features that people requested for, and how are you hoping to? Are there something that you hope to implement soon, or is something that will still be kept in the pipeline for a long time?
Yes, we've gotten a lot of feedback. Some have not been good. Technically speaking, not every feedback is good, right? Some
Yeah,
have not
yeah,
been good.
of course.
Some people have also actually given us, especially from the hospital part. We are currently working on API integrations on the particular portal, so you can actually just integrate with their own management system. Most hospitals, though, who actually use ours, kind of like just replace it like with ours. Whatever they've been using before, they just kind of like discard it and they replace it with ours. But some hospitals have tremendous amounts of data already, and they cannot just replace it like with our own. So they are kind of like looking for API integrations and all of that, and it's something we're working on before the end of this month, we'll definitely release that out too, so they can just integrate. I think that's like the major thing that people have actually like complained about, aside from maybe some features not working on the mobile
Yeah,
application. So we just kind of like branded it as a better phase or a better launch for the mobile
yeah.
application, that the full product is going to come out very soon and it's going to be significantly better.
So on beta now, at least you have some features there.
Yeah.
And then when you're launching out the full product, what are the features that you don't have on beta version now that when you launch out the full product, you will have them?
Well, I think for now, I think we have the basics, the basic functionalities, the AI chat assistant,
Yeah.
the testosterone trackers, gender-based tools for men and women. So I think for the full product, we are going to have more gender-based tools for men and women. We are going to have a lot of priority tasks, Then a doctor
Yeah.
actually suggested an emergency button on the mobile application, for elderly people.
Okay.
Sometimes elderly people
Oh,
fall at
yeah,
home and all
yeah.
of that. So they just click that emergency
Yeah.
button, and it's either the hospital gets informed, the hospital they use the most gets informed, or a particular
Yeah.
relative of theirs that they've added on their health records gets informed. Then we are also
Yeah.
working on NFC cards. That because instead of going to hospitals and they give you physical cards in paper and all of that, you just get
Yeah.
something like an NFC card. So you just go to the hospital, they scan your card, and immediately they get your medical records from whatever hospital you've ever visited that has been using Nyla AI.
Yeah.
So those are just a few that I can disclose for now because they are already working, So those are just a few I
Yeah.
can disclose for now, but a lot of other features are coming out very soon.
Oh, wow. I believe. Do you see your product? Do you have? I mean, what are the maybe some policies or regulations that are stiffening maybe the rolling of your product? Do you have some that you have to navigate at the moment in terms of regulations and policies in of Nigerian
Uh,
sector?
I think the main one is the NDPR, NDPR,
Yeah.
and then we also follow the GDPR. We have a data protection officer who kind of like guides
Oh,
us on
okay.
everything. Yes, we have a
Guys,
data
do. Oh,
protection
okay.
officer. Yes, so that's out, and we also have a lot of medical advisors. So
Yeah.
that's not a problem for us at Novo AI at all. We follow the strict rules, and they are very strict actually. Then also our product is HIPAA compliant. We make sure that it is HIPAA compliant. The AI model was actually trained by myself and a
Yeah.
lot of other AI engineers, and we got a 99.8% accuracy. So we
Wow.
just
Wow.
have a 0.2%, not even 2%, 0.2%, which is less than
Two.
1%. But when it comes to
Yeah.
health, it is still a whole lot when it comes to healthcare,
Is it?
So
Yeah. Yeah. I
that's
know.
why we are trying to say that it is not meant to replace medical doctors. Instead, it is meant to just
Yeah.
like redefine what they do or augment their performance better with AI.
Yeah. Yeah, yeah. I mean, that's actually quite impressive. I mean, with that number, it is impressive
Yeah,
because, well, I can't say we can totally achieve 100%
100%.
accuracy
Yeah,
because steam
yeah,
machine,
yeah.
right? Steam machine, but with that number, I believe that it's impressive. So, looking at the future, right? So, how do you envision Nyla AI, to reshape the doctor-patient relationship? Is this something that would enhance more human care, or in terms of health engagement, or in terms of some replace some certain interactions? So, how do you envision that it will enhance all of this?
Okay, so let me say I want, and I'm very sure Nyla AI will evolve to a trusted health companion for every African household, while also
Yeah,
being the operational system for hospitals and pharmacies. That's what I see for Nyla AI,
that's
honestly
what.
speaking.
Okay.
Yes, but for Nuvo AI in particular, I see it as being the backbone of AI-powered systems across Africa, starting with healthcare with Nyla
Yeah.
AI. But beyond healthcare, my broader vision for Nuvo AI is to prove that Africa can actually lead in AI innovation. Because technically speaking, we are even all of us right now, we are still practically using products from Western countries. We are basically consumers of Western
Yeah.
products. So we
Yeah.
are
Yeah.
we are trying to create our own globally impactful technologies. And there's one product we have in our pipeline. I can't really disclose much about it, but we
Yeah.
named it ARAI. It's an acronym that
Okay.
means African Research Artificial Intelligence. It's going to be
Okay.
something significant. Significant. When I say significant, I'm talking about rivaling the likes of
Disruptive.
Open.
Yeah.
Yes, disruptive, rivaling the likes of OpenAI
Yeah.
and Gemini. very soon in our pipeline. So we have a lot of products. In fact, one of the main investors we are currently in contact with, that was the product that he actually saw that
That
caught his
actually so
interest in
wow.
particular. Yes, so we have a
Wow.
lot of products in our pipeline that we are very sure that would make sure
That
Novo AI is the backbone of AI powered systems in
okay,
Africa.
yeah.
So if they just hear, if anybody hears AI right now, the first thing they think of is Open AI in particular and
Of
ChatGPT.
course, yeah.
So in Africa
Yeah.
and eventually globally, we are trying to make sure that when people hear AI, they are not just going to hear Open AI, they will also hear Novo AI. And I'm very sure we'll get
Nouveau
to that
AI.
point eventually.
I'm really rooting for you that you get to that
Thank you
point.
very much.
But just before I let you go, I actually want you
Okay.
to maybe talk about Idea Vault. It comes across to me as a platform for creators or to generate ideas. I don't know. That's what it communicates to me because at the moment you don't have much information around that, right? Because you don't. I don't think you have a platform for it
We
for
do
now.
actually. We
So,
do. It's on the website.
oh, I
Yeah, we do.
oh, I didn't say that. So what are Idea Vault about?
I would basically just say if Nyla AI is into health tech, Idea Vault is
Yeah.
into infrastructure tech.
Oh,
Like
okay.
I mentioned, Africans are very smart people. But
Yeah.
some people don't have maybe development senses or all of that. We have different skills. Some people can sell, some people can envision, some people can
Yeah.
build. So
Yeah.
Idea Vault is basically like a platform where you just go there and you type the products you have in natural language, and Idea
Oh,
Vault kind
okay.
of like develops it for you from idea stage to production stage. Every single thing you need to
Wow.
consider is kind of like builds it
Wow.
up for you. I think it's on our website. If you go to NuvoAI.Africa, we
I'll
have
check it.
two active
I'll
products
check it
here.
then.
They are on there. So
I'll check
Idea
it. I'll
Vault
check it
is
out.
basically people who have ideas in their head and they don't know how to translate those ideas to
How to
life. That's
transfer.
basically
Oh.
what Idea Vault does. It kind of like just brings out every single thing for you effortlessly.
Wow. I believe that's another game changing
Yeah, yeah,
platform.
yeah.
I actually believe. So
Mhm.
yeah, Gideon, it's been a good time. With you, even though we have issues with network
Network,
and
yeah.
it didn't really
That's
let
fine.
us enjoy the
That's fine.
conversation more than I actually envisaged. But it's good. It's been an insightful conversation with you so far. So thank you so much for joining me for this conversation. And
Thank you
well,
very
at
much,
least
sir.
I would actually also keep track with what you're building, and from this part of the world I keep cheering you up. And
Thank you
if you
very
need
much, sir.
our support in whatever way, maybe in terms of visibility or maybe even in terms of the consulting, in terms of the marketing part of it, yeah, I'm always a chat or a call away.
Thank
So
you very
yeah,
much,
so
too.
you can always reach out. Yeah.
Thank you very
Well,
much.
I would I
I
would
I, I, w-
provide.
I would also like to say I really love what you're doing at Bulbling 247. I really
Yeah,
really love what
yeah,
you're
thank you
doing.
so
Honestly
much.
speaking, it's keep it up, please. It's very
Yeah,
very
thank you,
encouraging. It's
thank you
very
so
very
much.
encouraging.
Yeah, thank you so much.
Thank you very much.
And one thing is our guests also get to recommend maybe one or two persons that they think that we should have conversation with. So yeah,
Okay.
but this is a conversation we take forward after the behind the camera. So you can get to recommend maybe one or two persons in your circle that are building
Okay.
solutions that are addressing common African challenges or
Yeah.
even global challenges that you think that they also have you want their stories to be shared, right? And also talk about what you're building, right? So yeah, it's been a good time with you once again. Thank you so much for coming on this platform. And yeah, that's the end of today's conversation. So guys, meet us for the next episode. Yeah. But before I go, keep bubbling. Thank you.